Hello, my name is Christina Henriquez, and I am currently a student at the University of Houston with the Graduate School of Social Work. A little bit about me: I have about 5 years of experience working with families who've been directly impacted by various forms of abuse, specifically child sexual abuse. I'm here today to talk specifically about child sexual abuse. It's been identified as a significant public health problem by the CDC. And according to California Social Work Education Center, sexual abuse of a child can have long-term effects on an individual's psychological, emotional, and physical well-being. These effects can lead to dysfunction and distress. Today, 195 children will be sexually abused in Texas. 1 in 4 girls are sexually abused before her 18th birthday. 1 in 6 boys are sexually abused before his 18th birthday. It is time that efforts be made to primary prevention efforts to prevent this debilitating problem. Today, there are currently very few evidence-based prevention programs that focus on adults. Primarily, they focus on school-age children. I'm here today to propose an effort to educate and empower Texans an opportunity to make our community safer. One of the most effective ways to create prevention is through community-level interactions. This statewide program would consist of 3 main strategies. 1, through mass media campaign. 2, through technical assistance. And 3, through education. A similar program was implemented in Georgia, and according to their study by Schober and Fawcett, 4 of the 5 years of implementation, they had reduced number of confirmed sexual abuse cases. As part of the mass media campaign, it will bring awareness in 3 areas, and it would focus on providing information in regards to warning signs and where to call for help. According to a study by Brown and Ringgold, mass media campaigns can make a significant impact on the community at large. They bring knowledge, awareness, and can change the perceptions of a public health issue, creating a positive behavioral change. They were able to conclude that community members' attitudes were positive about the media campaign. This leads to our second strategy of technical assistance. We will create a hotline formed of 12 trained hotline counselors that will be available 24/7 to answer calls related to sexual abuse. These trained individuals will be able to provide information to callers about warning signs, dynamics of sexual abuse, and also guide the individual on how to make a report. Oftentimes, when callers are making reports to a local CPS agency, they don't have all the information needed to make an accurate report. The hotline counselors would be able to walk them through with all the information that they need to gather in order to provide this information. One of the main concerns about prevention programs is how do we create sustainable programs where communities are left to be empowered to continue to spread awareness and also be held responsible for the safety of today's youth. We will implement a training program that can be made applicable to various groups, parents, educators, community leaders, and so on. It's a training program that will provide comprehensive approach in bringing awareness and knowledge around the issue. The evidence-based program shows statistically significant improvements in several aspects of behavior, knowledge, and attitudes regarding child sexual abuse. This model is one of the only models that seeks to create long-term outcomes and the very first to focus on behavioral outcomes. This prevention effort will consist of a task force. They are members from various nonprofit, for-profit, and government agencies. We have currently secured 12 of the 15 members that would like to be a part of this task force. They will be responsible in creating strategic strategies as well as ensuring goals are being met. So why am I here today? So in order to make this an effective prevention program, we are asking an investment of $10,000. This will cover expenses for mass media campaign and dissemination of information for the training program. So who would like to help with breaking the cycle of sexual abuse?